Today we have Dr. Kersi Chavda with us, who is a practicing leading psychiatrist, practicing in Mumbai, past president of Bombay Psychiatric Society, and has 40 plus years of professional experience in the field of psychiatry. I'm extremely delighted today to have him with us. Dr. Kersi Chavda, welcome to my channel, Life Unscripted with Arpita. And thanks a ton, sir, for agreeing to come.
It's a pleasure. Thank you so much. Thank you.
Thank you. Sir, my first question to you is why psychiatry?
Well, it's a little difficult to actually say why, but I remember that when I was doing my MBBS, my undergrad, I used to have friends come up to me and talk to me about some of the issues that they were facing, some of the problems that they were facing. And at that time, I really didn't know what I was saying. I didn't know anything about psychiatry, but whatever I suggested and advised seemed to work. And I do believe that I'm a fairly good communicator. So somehow what I said and the way I said it made a difference to the way people reacted. After doing my MBBS, I always wanted to do either something in children, that is pediatrics, or do something in psychiatry. And I got into psychiatry, and then I was very lucky in that I also trained under an American child psychotherapist for a while. So I got the best of both the worlds. Though I do psychiatry across the spectrum, my field of interest has always been children, and I've done a fair amount of work in that field.
Right. So, sir, do you get enough children patient in your profession as on today?
It used to be only children at one time. At one time, about 70 to 80% of my clientele were kids. But now we have kids with their parents, and then you have the parents coming in with their friends and so on and so forth. But there's a huge amount of kids who have issues. Fortunately, people are seeking help at younger and younger age groups. There's been a sea change in the way people look at our profession over the last 20, 30 years. So at least that this change at least is fairly well manifest.
Right, sir. Sir, as you said, kids. So, means how, what is the age?
Well,
like starting from?
It could be actually from birth. I mean, if you have a kid who's very obviously born with some kind of psychological, or, I mean, neurological or whatever issue, or even logical issue, or genetic malformation, then right at the beginning, the parent comes to me because, you don't get married expecting a divorce. You don't have a child expecting that there will be something wrong with it. So it could be devastating, especially if you are not prepared for it. Now, there are times when you do a genetic test and you find that the kid has some problem, so you kind of know that there will be an issue. But sometimes you don't know. And when you're expecting that life will be full of joy, and then suddenly life is still full of joy, but you still have major issues, and that can be tremendously traumatic. So sometimes parents come in just even a month after birth. You also have kids who are very young, and then maybe because of, say, of epileptic fit, or because they've had some injury, or because of something that gets manifest after their birth, they'll have issues either with speech or with movement or things like that, and that itself can be very traumatic. So kids can be brought in very, very young, and we always say that the younger the child, and the earlier we start treatment, the more effective it's going to be, and the more likely it is that we are going to land up having a positive result.
Right. Sir. So, sir, today you are happy with the decision you took 40 years ago, right?
I
About
think
psychiatry.
sometimes one gets so exhausted that one thinks that maybe one should have done something like pathology, where you just look down a microscope, skin, where you're dealing with, happy things. Unfortunately, in psychiatry, there's a lot of unhappiness. If you're doing skin, for example, you get acne and you deal with it. You have a fungal infection and you deal with it. If you get into aesthetics, then you make a person look more pretty, which is nice. Of course, there's a lot of rewards in my field. Absolutely no getting away from that. I'm privileged that I am in the position that I am, where a lot of people seem to like what I do. But it can be exhausting. And the legalities associated with psychiatry are horrendous. Sometimes one does wish that it wasn't so difficult.
Okay. So it's sort of a mixed feeling.
More
Okay.
negatives, but there are very often times when you start wondering just what you're doing and whether you should retire.
Oh, okay. But I think that happens with everybody. है ना? Okay. Sir, you have 40 plus years of experience. So, do you see any change in your profession in the sense what you see today and what it was 20 years back?
There's a sea change. When you
Okay.
started off 40 years ago, people were very, very scared of going to a psychiatrist. This whole thing of Pagal ka doctor, which still
हाँ.
exists to some extent, but it would just be about 10% of what it used to be at that time.
Hmm.
So at that time, you hardly had patients and you hardly, you went around very diffidently. You never acknowledged your patient on the road and so on and so forth.
Oh.
Eh, my colleagues and I have more patients than we can deal with. I mean, we actually tell people, don't come to us, find somebody else. I go to a party and half the people in the party come up to my wife and say, we go to your husband for help. And my wife is astonished and says, does the whole world need help? We go to schools and everybody seems to want us to talk about school mental health and yeah, the work that is done with children because of the horrendous suicides that we see in schools. We go to corporates now. In fact, this year the
Hmm.
WHO mental health uh, slogan is work in the mental health in the corporate place, which is so very important because it's all very well to want profits, but it doesn't make sense if the
Hmm.
person is going to crack up in the attempt to do what he's supposed to do at work.
Hmm.
We have the LGBT community with their own attendant problems, and there's so much of work that has happened with them, and they come to us for help. So it's
Hmm.
a huge, huge, huge change. We, I think, are more accepted, much, much more than what we used to be.
Hmm.
Uh, I go to the gym in the morning, for example, and about 30 to 40% of the people in the gym are my patients. So and they come up, the thing is now they come up to you and
Hmm.
very they say, we are taking medication, we are seeing this doctor. At
Hmm.
one time, it would be a very nudge, nudge, wing, wing thing, but today it's very open. So there's teach, at least in Mumbai, and
Hmm.
I'm sure metros, there's a sea change. It may not be in the smaller ones.
Hmm.
The other aspect also is that we all, my colleagues and I, all have a huge number of clientele which come from other smaller cities and smaller villages
Right.
like that, which is wonderful. And there have been some villages, for example, where the panchayat has sent people to me.
Oh,
Yeah.
acha.
So there is awareness. There's a lot of awareness.
Yes. Yes.
It's that it's so prevalent today.
Yes. So there is a sea change of positive changes, right? Okay. Sir, can you tell us about two of your most unusual cases?
Okay.
Yes.
One which I have actually put on Facebook once because I love this case. There
Hmm.
was one person who was brought to me. I mean, he came to me.
Hmm.
I was a little startled because apparently he told me that there was this way in which you can actually find a hitman and you tell the hitman that I'm going to give you X amount of money and
Supari.
Supari, and you kill them.
Supari.
So you do Supari on yourself.
Yes.
Now, he told this guy that guy apparently was a little startled, and then he asked him what was wrong, and the chap told him what was wrong, and this hitman actually patted him on the back and said, "Go see a psychiatrist." And I thought that was fantastic. I thought that
Yes.
was incredibly fantastic. So the guy looked around, found me, and he met me, and he told me about this, and he was laughing. And today
Hmm.
he's doing very well. But I want to thank the hitman. I think it's great.
Yes. Yes. And he is all right today, that man.
He's all right.
Okay. But, sir, can I ask you what was the diagnosis for him? What
Severe depression.
severe depression? Oh my God.
Severe depression.
And any other case?
So then there was this other one where something that was very sweet. I was in my OPD and there was a mother who came in with a kid who had severe autistic spectrum disorder. So he was mumbling to himself,
Hmm.
poor contact, and so on. The mother was very sad. I said, "What happened?" So she says, "Doc, I was sitting outside waiting to come in, and one of the guards, because my son was sprawled all over and uh, talking funnily and people were looking at him, one of the guards came up and very roughly told him, sit properly. What are you doing? So my son got very frightened. And I don't
Oh.
think the right thing to happen in your hospital.
Hmm.
I said, I agree. And after we finished the session, I went out with the kid and I went to that guard and I fired that guard and I made the guard apologize to the guy. And I took the kid to the lift and I told the lift man, ये हमारा मेहमान है उसको अच्छी तरह से नीचे ले आओ. Liftmen are normally very, very nice and so are the
Hmm.
guards.
Yeah.
To cut a long story short, I forgot about the case.
Okay.
Sometime later, I got a parcel.
Oh.
And the parcel came to to the hospital, and it contained a little cutout of a apron with a stethoscope drawn on it.
Oh.
Some some symbols denoting love, and a lovely thing
Hmm.
written by another patient of mine who apparently had been waiting in the waiting area
Huh.
and seen this little transaction. And
Oh.
among the various things that she wrote, saying that I now know that I've come to the right place because at least you care for us. Nobody realizes that having a mental problem is a very lonely affair. And I was so touched and so affected by it. I mean, you just do what you think you have to do because it's somewhat the right thing to do. But when somebody else sees what is happening and gets touched and sends you such
Yes.
a beautiful little
Hmm.
thing,
Hmm.
is that packet containing the thing. And that other patient now, who incidentally had severe social anxiety and couldn't talk in public and now is doing fantastically,
Hmm.
we are in touch. And I keep telling her that she's one of my cutest, sweetest, loveliest patients. And she keeps saying that because of you, I can talk so well now in public. And she's
Okay.
in her job, which required her to
Talk.
communicate effectively. Yeah. So that was a lovely, lovely, lovely thing. Sometimes small little things like that make you feel so good. One more,
Yes.
if you don't mind, I'm going to say one more because it just came to my mind again. Rainy day, terribly rainy day. And this guy comes in with his wife and says, "Arey Doctor Saab, मैं भूल गया." He works in a milk place. So he says, "मैं भूल गया, मेरे पास पनीर था, मैं आपके लिए लाने वाला था." And I laughed at him and I said, "Arey, my wife told me, आज जब आप आओगे तो just get about, X amount of grams of paneer. लेकिन कोई बात नहीं, अगली बार हम आपका पनीर खाएंगे." I finished off with him. And then about an hour and a half later, he
Huh.
came from very far away. I mean, I
Yeah.
was practicing wherever I was, and he came by train. It took him about an hour to come. About an hour and a half later, he calls me and he says, "Doctor Saab, aap hospital se mat nikalna." I said, "What's wrong?" Apparently, he had called up his elder son, who, in the midst of all that rain, had got into a crowded compartment of a train,
Yes.
slowed his way to my hospital, and came and he gave me that paneer, saying, बोला और भाभी को चाहिए था मैं कैसे नहीं ला सकता. I mean, things like that make it all worthwhile.
Right. Priceless packet
Priceless.
of paneer. Yes, that is so lovely. Sir, out of three genders, male, female, and trans, what is the percentage, approximate percentage of your patients?
I think men and female are almost equal, trans much less, but trans are coming more and more and more now.
Mm. Okay. Maybe 10% of your patients are trans?
See, it's like this. A lot of people come in before they undergo whatever
Right, right. Yeah. Mm.
because before they undergo whatever they're undergoing, they need a psychiatric
Mm.
certificate saying that they're
Okay.
understanding.
Oh, right, right.
It's not trans. I mean, okay, they are trans in terms of they haven't yet undergone the operation or whatever. They have gender dysphoria, which is a different thing.
Okay.
They are in the wrong sex, etc., etc. So,
Mm-hmm.
amount of them. I mean, initially it used to be maybe one or two in 6 months. Today it's probably three or four every month. So it's becoming more and more.
Right. Okay. Okay. Sir, do you see any particular age bracket in your patients for any particular ailment, mental ailment?
Not really. I mean, there's a huge amount of people now who are coming in post menopause. So ladies who are postmenopausal, they're having a lot of depression, put on weight,
Hmm.
can't, things like that, get very irritable, and they come in. There's a huge amount of women now who come in again with postpartum depression.
Martin. Hmm.
One time, nobody believed it was true. Fortunately, now everybody knows that
Yeah, yes. Actually, doctor, I also had that, and I didn't know. Nobody knew in the house. Nobody understood. And it was so sad. And somehow I came out of it. But now I understand it was that
So,
time.
so we have this postpartum thing. A
Mm,
lot of people are coming to it. And now the latest thing, of course, not the latest thing, it's been since a while, that you're
mm,
not supposed to fool around with your medication if you're pregnant. You're not supposed to fool around with your medication if you're lactating, except in a few cases. Because
mm.
now that if you keep the medication going, the chances of your having a baby who's normal and happy and not having problems is much higher if the medication continues, provided of course you're under the supervision of a doctor who knows what he's doing.
Okay.
Would stop the medication, the woman would go berserk, and that would cause more problems. So now
Oh,
things change. So this is certainly something. In men, we see a huge amount of addictions, unfortunately. We are also seeing more and more men who land up attempting suicide, which is a horrible state of affairs. Women also.
ah,
The statistic is that women attempt more, men complete more. So it's not a very nice scene.
okay. Okay. Substance abuse, like what? Like alcohol, drug, or like,
Both. Both.
okay. Okay. Okay.
Alcohol
Okay.
has become a social thing. The hassle is that lots of people can't control the amount of alcohol they have, and then that lands up becoming a major problem.
Yeah.
Uh, Substance abuse now is again becoming extremely common. Unfortunately, weed and
Hmm.
hash and
Yes.
things like that are so very common. But now
Yeah.
people are into MDMA and coke and mushrooms and things like that, which are becoming easier and easier to unfortunately get procured. In
Oh,
our city, we'll end up having a whole bunch of problems. The sad thing also is that I often have seen husband and wife doing it together, and then the kid grows up and the kid also does it, and sometimes they're all three doing it together, and
oh my
that's
God. Substance abuse.
yes. So it's
Oh
for it.
my God. That's a crime.
Okay.
Oh my God. Oh, acha. Doctor, one thing you said something, so I'd like to clarify. Did you say during pregnancy the psychotropic medicines are absolutely safe to have?
Nine.
Oh, oh,
There are some which we would not allow, but a huge number allowed. And now, fortunately, gynecs are also understanding this. At one time, the gynac would stop it.
huh.
Most gynects would call you and talk to you and say that, are these medicines safe? You're the guy who knows, so let
Hmm.
us know. And then they're supportive.
Okay, okay. That's great. Acha, sir, what is the average number of patients you consult every day?
I don't know.
No. And the total number of patients undergoing treatment from you presently?
I have absolutely no idea because I practice in 4 places plus their video consults. So shall we say it's a big number?
So you have no idea, like 10,000, 50,000, 3,000.
No, I a lot of people.
Okay. Okay. Acha, so the whole day you were listening to sad stories. Okay. And you cannot show any impatience or irritation on your face because your profession doesn't allow you to do that. So do you sometimes feel bored or taxed, or this new sad stories motivate you?
No. I don't think they motivate you, excepting
Hmm.
if they that is that is very different.
Hmm.
One does get tired. There's no question about that. I am considered to be a very patient guy,
Hmm.
but now I find myself snapping at times, which is not good for the patient. I understand.
Hmm.
It is sometimes very, very taxing. Uh, there are
Okay.
some kind of cases which really get at you, and the ones that really get at you, for me, is child abuse, child sexual abuse, which I want to kill the person who's done it.
Yeah.
And
There. Yes.
nowadays, I'm also finding a lot of elder physical.
Abuse.
So you have grandmothers being pushed around, grandfathers being hit, and all of that, and I
Hmm.
cannot even imagine how that could be.
Yeah, yeah. And we get news is like the son killed mother and all. Hmm.
So that kind of thing really gets at you. The usual
Hmm.
stuff you cope with. Some horrendously difficult cases you start feeling very bad about. But I mean, after so many years, one learns to detach to some extent. Now, the hassle
Yeah.
also is sometimes you detach to such an extent that you might land up coming across as being a little cold at home or cold with your friends. because that's the only way that you're able to cope, which is not the best thing in the world. And we are aware of it and we try to change. That happens.
Okay, okay. So the happiest moment in your 40 plus years of professional experience? Huh?
I can't think of any happiest moment. Lots and lots of happy moments.
Okay.
Can't grade them. You can't really grade them.
Okay,
Yes,
right.
if somebody was very, very suicidal and then comes back and is doing very well, or
Hmm.
the who's been consistently failing because he's got attention deficit hyperactivity with
Hmm.
your learning disability, and with your interventions tops class, things like that. I'll
Okay.
about one case. There was this kid who came to me. I've been quite a big person in the learning disabilities field.
Hmm.
We were part of the first governmental panel which got concessions in the 10th and 11th, in the ninth and the 10th. That was 30, 40 years ago. Now, of course, it's become very routine and commonplace.
Hmm.
So I remember this kid came up to me and he had what we call dyscalculia, which is a learning disability for math. So you have a major problem with math. And we had got the concessions and all. So I told the kid, you can drop maths. He says, I don't want to drop maths. I love it. And I
Oh.
said, but it's going to be very difficult. He says, I don't care. I want it. I want to do it. I want to do it. Parents were saying, we are supporting him. We want him to drop maths. We know how much he struggles. What do you do? So I said, okay, let him try.
Hmm.
The guy got through maths in the 10th. He got through maths in the 12th. He got into IIT and he did a PhD in maths or whatever the equivalent.
Oh my God.
Amazing. So that was an eye opener for me, that even though you might have a problem and a real major diagnosable problem, there are times when your own desire for something makes it happen.
Happen.
So it helps you get a little more humbled.
Hmm. 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 Okay. So yeah. And the any saddest moment you can say like,
Well, I remember that there was this, for what it was worth, I was dealing with a guy and he had a major problem and I had put him on a particular kind of medication. Then I had gone abroad. And when you go abroad, there's somebody who normally looks after, especially the more difficult ones. So this guy had gone to this other doctor, very dear friend of mine actually, and she had changed the medication because whatever happened, and that guy got a allergic reaction to that medicine and actually died. Those things make you feel terrible. You start wondering whether you could have done something else. Any suicide that happens on your watch, you go over and over and over and over and over about it, wondering whether something else could have been done to have prevented it from happening.
hmm.
Major attempt at what we call deliberate self-harm, where you have maybe a kid or an adult
Hmm.
cutting or cutting herself because of the emotional um, problems that he or she is going through, and then they feel that they can't cope, etc. And you
Hmm.
terrible. Any
Okay.
child abuse cases, sometimes you have parents who are so incredibly brutal, you wonder why they ever had kids.
Exactly. Yeah.
And those
Hmm.
kind of real,
Home is the safest place for us, right? If the home is not safe, then where do we go?
I agree. It's terrible.
Mhm. Yes, yes. So, do you sometimes get emotionally attached to your patients?
To kids, occasionally, especially if a kid has something like a cancer, you feel horrendous. I mean, you do your best you can to enable the kid to live a good life, but you know that given the statistics, unless some chamatkar happens, the kid has X amount of years to live, and chamatkars don't happen. So then you cry as much as the parent would cry.
Yes. So, sir, what do you do to keep yourself mentally fit?
I work out a lot. That's the thing that I've been doing since more than 35 years. So that really, really helps me. It's nice, when you're working out and you're pushing weights, you give galis to the person who you can't stand, and that helps.
Yes.
Big group of friends, and we talk nonsense and we fool around and we talk. I have some lovely, lovely colleagues. When I'm very down, they're there and they support me. Sometimes when I'm feeling down and I want to just chat with somebody professional, I have a whole bunch of colleagues and I know that they'll do anything for me just like I would do anything for them. So, and I have a wonderful family. My wife and my in-laws, and I mean, my parents are no longer alive, but everybody was so incredibly supportive and is still so incredibly supportive. it makes all the difference in the world.
Mm-hmm. Right, sir. And what is your advice for others to keep themselves mentally fit?
Live a good lifestyle. Drink enough water,
Hmm.
exercise regularly. Um, don't get too much onto the cell. I'm a bad person. My wife keeps telling me I'm on the cell all the time, but try to avoid it.
Hmm.
Um, don't drink too much. Drink a bit if you have to. Certainly don't do drugs. Get enough sleep.
Hmm.
Try to surround yourself with people who are also not in your profession. I mean, I have a lot of friends who are not doctors. Others, when you're with doctors, all you do is talk about patients.
Hmm. 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 Yes. Hmm.
And then finally, my biggest mantra is take yourself with a pinch of salt. Don't take yourself too seriously. Uh, you are not indispensable. If you're not there, the world will go on without you. People will cry for a week and then they'll find somebody else. So don't
Right.
take it so incredibly seriously, which sometimes people end up doing.
Hmm. Right.
That's
Okay. Does a psychiatrist sometimes consult another psychiatrist for his or her mental health issues?
absolutely. It's like
Okay.
an orthopedician should not have a fracture. It doesn't happen. Or a cardiac surgeon cannot have a heart attack. Of course he can. So just like that, we all, in fact, we are under stress all the time.
Hmm.
The highest, they've done studies and they've actually found that the highest incidence of suicides amongst all the professions is amongst doctors. And amongst doctors, it's among psychiatrists. So we have the highest suicide rate in the world, in all the professions.
Okay. So this was actually one of my questions. You already answered it.
Okay. So we have a huge uh, propensity towards getting affected because of all the nonsense that we are facing and what we have to deal with. So
Hmm.
it's not that a lot of us are depressed, a lot of us have panic
Hmm.
attacks, a lot of us have access to drugs and to alcohol because we are doctors. So you'll end up taking more of what you should not be taking if you're not careful.
Oh.
Most of highly obsessive, so we get stuck on a patient and that patient doesn't leave our head, so we get stuck and we get stuck and we get stuck, which affects us. Not surprisingly, then, if you're not careful and if you can't detach adequately, you'll
Hmm.
end up your depression, you'll end up attempting suicide, you'll end up having breakdowns. We have psychotic,
Okay.
yeah, we have psychiatrists who also have psychiatric breakdowns. Why shouldn't they?
Okay. Okay. That's very sad.
And psychiatrists make the worst patients, so it becomes difficult
Oh. Acha.
because they seem to know. I mean, we know a lot of stuff, so it's like, no, it hasn't happened to me.
Yes, yes. Okay. Oh. Acha, on September 6, 2018, the Supreme Court of India decriminalized the sexual relationship between same-sex adults, right? Section 377. Did you have any role in bringing that?
Yes, I did. So what happens is the Indian Psychiatric Society has what we call certain task forces. So the task forces are you have across India, you have somebody who's a chairperson, somebody who's a co-chair, somebody who's a convener,
Hmm.
and work on a particular thing. So you have, say, a task force on school psychiatry, which I am chairperson of right now, and we do a lot of work in schools. You have something in college, you have something in geriatrics, you have something biological, you have something with media, etc., etc. And at that time, they had started something on the LGBTQ community, and the then president of the IPS, Dr. Ajit Bhide from Bangalore, called me and he asked me if I'd like to be the chairperson. So I was a little diffident. I mean, I am absolutely cool with gays and so on, but I mean, I didn't know enough about that. So I said, okay, let me try. At the same time, we had an activist doctor friend of mine who, along with his other co-mates, had set up, they put in this petition in court against 377 to decriminalize it. Now, what happened was that my two other colleagues and I, there's a Dr. Avinash D'Souza, who was the convener, and a Dr. Amrit Patajoshi, who's currently the secretary of the IPS, and at that time was my co-chair. He's from Bhubaneswar, a lovely, lovely, lovely person. Both of them, both my very, very dear friends. So the three of us got together and we worked a lot in. We had a huge number of seminars across India, almost.
Hmm.
Uh, and at that time, we pushed forward, and the Indian Psychiatric Society came out with a position statement on LGBTQ, saying that it's not a crime, it's a variation. It's not a disease, it's a variation.
Right.
Finally, when it came up to the court,
Hmm.
3 of the 5 learned judges quoted our decision and said that we will go with what the IPS says and we are going to decriminalize it. It's not a crime, it's just a
Hmm.
variation. It's considered to be wrong to criminalize something that is not a crime, etc.
Hmm.
Technically, I have decriminalized something like 12% of Indians. That's nice.
Okay. So
Now,
currently, are you working on any other burning issue of LGBTQ community, like legalization of same-sex marriage or something?
well, they had gone into court and they had taken our input and we had supported them, but now this becomes more social rather than psychiatric. Getting into marriage and so on and so forth is more a social thing rather than psychiatric. We gave
Hmm.
them input, we gave them all the support we wanted, but at
Hmm.
that time, it didn't happen. I would expect that in the next 20, 15, 20 years, it should happen. I think it's almost
15, 20 years. That's a very long time.
go very slowly in our country.
Okay.
I mean, hope
Right.
that it's fast because I have some very, very dear friends who are just waiting to get married. They've been together for 15 years, 20 years, and they don't want to get married out of India. They want to get married in India because they love the country,
Okay.
but, but they can't.
Hmm. Okay. So do you agree that mental health should be taught in the school curriculum level?
Yes, absolutely. And it is being taught to a large extent. A lot of people.
Within states or like in central board syllabus? How? Like, could you please
Okay.
explain how far you have gone in this?
So a lot of maybe individual schools are doing work in the field of mental health. So they have people coming in and talking on various things. So
Hmm.
I have gone and spoken on single families. I've gone and spoken on the LGBT. I've gone and spoken on drugs. I've gone and spoken on depression and so on and so forth.
Hmm.
I'm part of a group called, at least in Mumbai, called Project Mumbai, and we have a vertical called Smiling Schools, which is
Okay.
for BMC schools. So over the past 6 or 7 years, 2 standards of the BMC schools
Hmm.
are input related to mental health. So maybe at the 8th and 9th standard, they talk of drugs and bullying, and the 7th standard, they talk a little bit of sexuality and so on and so forth. Good
Okay.
touch, bad touch,
Hmm.
single, sex abuse, all of that.
Hmm. And
Over the last,
pressure, academic pressure, do you address that also?
yeah,
Okay.
yeah. So
Hmm.
through the years, we managed to touch a huge number of kids. I think it's close to about 10,000 or so. And
Okay.
every more and more are coming in. So at least we are trying to do something in my city. Similar things are happening in other cities as well. Similar people, and a lot of my colleagues who are psychiatrists in other cities and other states are doing an enormous amount of work. So we all know that if you can get the kids to be psychiatrically happy in a
Yeah.
sense or not disturbed too much, or we can find out if they're having problems when they are young or they have a disease when they are young and we start treating them
Hmm.
at that time, then the chances of their total recovery is so much better.
Right. Okay. So how do you unwind at the end of the day, at the end of a very busy day?
I normally sleep. We sleep very early, but what happens also is that we just sit
Hmm.
and around. Sometimes we do go out because we have a good friend circle. Occasionally have a drink. Occasionally go out and watch a play or a movie or go out for dinner with friends. That kind of the usual stuff. I try to
Okay.
take breaks. I take much fewer breaks than I actually should. But now, at least in the last 1 or 2 years, I'm trying to take more holidays, which sometimes causes a lot of anguish with my patients who believe that I should
You
not
are
be.
indispensable.
Yes.
Yes. So what keeps you what motivates you to keep going throughout the day for transforming lives with positive energy?
I think I'm exceedingly privileged. I'm also very lucky. I know that there are lots and lots of people who would probably be better than me, more knowledgeable than me, nicer than me,
Hmm.
but I've been in the right place at the right time and somehow things have managed. So very often I wonder how it would have been like if I was in a small little city or in a small little suburb in a city,
Hmm.
or seeing just 4 or 5 patients in a day. I'd
Hmm.
never had the opportunity of being interviewed by people like you and things like that. So I think I'm extremely privileged. That keeps me going. Sometimes I'm exhausted. It has
Hmm.
its good and bad components. I think the good far outweighs the bad, but there are times when you are in a very bad shape and you sometimes wish that, that in spite of the fact that you did things with good intentions, they may not work out, and then you're blamed for what is absolutely out of your control. That becomes a little problematic. So I think that keeps us going. And when you actually see people with problems doing well, coming to you, smiling,
Hmm.
somebody who's suicidal, no longer suicidal, somebody who's extremely socially inappropriate, coming out and talking confidently, things like that make a lot of difference to
Okay.
your own well-being. Yeah.
Yes. Where would you love to see Dr. Kersi Chavda in the year 2030? Same like now or little different?
Or it'll be much different. 7 years later, I'll be much older.
Huh.
And what we normally see happening is
Hmm.
things are changing. Now, right now, artificial intelligence is becoming the norm. So I have no doubt there's going to be a lot of AI coming in, even in my field.
Hmm.
You may not want to actually speak to a computer rather than a doctor, but the computer may be actually more efficient because what we take a lot of time to think over, they finish in a couple of nanoseconds.
Hmm.
But I'm still a little diffident at the thought that I
Hmm.
sit in a screen and I tell him what's happening, and AI tells me you have depression. I don't really think I'd like that too much, but it might happen. I see
Hmm.
that. Point
Okay.
two, I think the stigmatization will be much, much, much less. It's already much less, and I'm sure it'll be much, much more. I mean, much less, so that just about everybody will be going to a psychiatrist, and it might actually become a thing to be proud of. This is my psychiatrist. He's the best kind of thing,
Yes.
which
Yes.
is a nice thought. I would also hope that there are a huge amount of legalities that have come in and a huge amount of things which actually make it difficult sometimes for us to do what we know will make a difference to the patient, but we are not allowed to do it legally. And we would hope that there will be a little rationalization of all these rules so that if we do something
Hmm.
in faith towards the patient, it doesn't rebound on us and it doesn't make us legally liable.
Yeah.
Sometimes does happen and cause us then not to do what we would have otherwise done, which would
Okay.
make a difference to the person.
So, can you give one example of that? I didn't get like what exactly you meant by this.
Difficult to give examples, but I mean, for example, supposing I wanted to do a particular thing which I know would make a difference to a patient in terms of giving medication in a particular way,
Hmm.
and it is not allowed. In the
Hmm.
past, America, for example, they have a very woke community, so everything is rights of patients. We sometimes forget that right of patients is fine. What about the patient's parents? You ever have parents who have a bad case at home, and because of the legalities, you're not allowed to do what, maybe pick up the person, get him treated, even against his will and all. There are lots and lots and lots of legalities. A lot of people would not want to do that and then they suffer. Well, we know that if you didn't have so many legalities, it could be done so easily
Hmm.
and you'd get a very effective reaction and everybody would be happy. So, yes, we have to look after the rights of patients. Nobody in the least is saying we shouldn't, otherwise, we would still have them being tied up and chained and all of that.
Hmm.
But we should also remember that life is not so simple. And I'd like to believe that all doctors do things in good faith. So if you do things in good faith and for whatever reason it doesn't work out the way you want it to, it doesn't mean that the doctor has to be legally penalized or trolled. That is not a good thing.
Okay. Right. So, have you thought of writing a book based on your 40 plus years of experience
Well, a
in
lot
the
of people
field of?
that I should. My hassle is that I have a lot of very high flying clientele also. So if I do write about them, I might get shot. So I
No,
don't.
you will hide the identity, no?
Sometimes it's very obvious. I've thought about.
Oh.
I've thought about it. A lot of people have told me. They've said that just put down of the happier cases you have because when you read a happy a happy book on mental health, then people it's not so bad, it's not so frightening kind of thing.
Yes,
Right?
yes.
Possible because I'm just so busy and everybody says that they will help me and this, that, and the other. We will do it when we are semi-retired.
Okay. But actually a book now that will help people throughout the nation to identify with their own problem, mental health issues, and
I,
they will come out.
I
Sometimes they do not even know that they are having this problem and they need to go to the doctor. No?
sure.
Yeah. Sir, can you kindly explain for my viewers these terms like psychiatrist, psychologist, clinical psychologist, counselor, therapist?
Okay, so a psychiatrist is basically a postgrad in medicine who's done a postgrad in psychiatry
Hmm.
and the only one who's allowed to give medication.
Right.
Can also do therapy, but he's allowed to give. He's the only one who's allowed to do medication.
Hmm.
A psychologist is somebody who's done an MA, so or an MPhil. So they are not doctors. They've done a postgrad in psychology, not in psychiatry.
Hmm.
They are allowed to do depending on what they've done. So you have a counseling psychologist who does counseling. You have a clinical psychologist who basically does testing.
Okay.
You have an industrial psychologist who might do stuff related to industries.
Okay. Right.
Have sports psychology, which is becoming very big now, where you work with the sports people.
Oh, yeah, yeah, yeah.
You
Sports
have
psychiatry.
that.
There was a team of sports psychiatrists, I think, with the Olympic team, no?
That's right. For the first
Hmm.
time, psychiatrists also went. In other words, there's normally only psychologists, so that's great.
Hmm.
Then you have geriatric psychology, where you basically deal only with the old people and their dementias and their nervous system degenerations and things like that. So you have
Yeah.
various. A counselor is a person who does only counseling. A therapist
Okay.
is a person who does basically therapy.
Right. So these days, I found in YouTube some relationship experts. Who are they?
I, I'm a
Yeah.
very skeptical about relationship experts and other things. Sometimes you just do 3 weeks of some course and you call yourself a doctor, expert in,
Expert.
and I think it's horrendous. I think it's absolutely horrendous and should not be allowed.
Yeah. Okay. Sir, any unfinished job in your professional life?
Oh, okay. I don't know. I mean, there's more than enough work to do. So maybe you can say that I haven't done this and I haven't done that, but I think I've done a fair amount of work. So I'm quite
Okay.
pleased with the amount of work I've done. I mean, it's never enough, given the fact that we have such a huge population. Maybe if I were in a slightly more senior position in a place which was more national, I could do a little more work. But then, I mean, eventually I have a separate life also. And then I don't want to just spend every minute of my day doing only psychiatry. I have a separate life to live.
Mm-hmm.
I think, on purpose and with a lot of pushing from my family, decided not to do more than what I'm doing because. And
Yes. Sir, what I have already come to know what saddens you. Okay. But what excites you? You have to think.
I have to think.
Oh, so sad.
No, 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 no. Because lots of things make me happy, but what excites me probably is something new. You kind of have given up on a patient, say, and then something happens and that patient does well. That's very exciting. Uh, you have a patient who's about to die, and some intervention happens and that patient lives and thrives. That's incredibly exciting.
Yes.
Things like that.
Okay.
Animals excite me. I
Okay.
love.
Like,
No, no, I love dogs. So when dogs are jumping all over me and
oh, yeah. 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 The animals are lovely, actually. Do you
they
have dogs, sir?
our lifestyle doesn't allow it, but we know every dog in our lane. So when you hear them barking, we go running down, or they come over home and they
Okay.
reduce the stress that we experience.
Okay. Good. I am also animal lover, so I'm happy to hear that. Okay. Sir, there is a segment of society who are long-term caregivers.
Yes.
Some are parents who are having children with some physical or mental challenge. Some are having senior old age parents who are either bedridden because of paralysis, or they are not mentally very stable because of dementia. Some are even having adult children who, because of some mental or physical challenge, still dependent on them.
Yeah.
So do they come to you for help?
Yeah. A lot
Hmm,
of them do. I mean,
hmm,
at one time, the average age of,
hmm,
I mean, the average percentage of people who would be above the age of 65 and who come to me for help, maybe about 10, 15 years ago, would be about 10 to 15%. Today, I think as much as 30 to 40% of people who come to me are above the age of 60.
hmm,
And it's a little sad. Some of them, if they're very lucky, come in with their family. Some of them come in with caretakers. Some of them
hmm,
come alone because their family is abroad, or their family is in another city, or their family is just too busy to be able to come with them when they have a problem.
hmm,
It's sad. It's very sad. We are seeing more and more of it. We don't have enough old age homes, which are very good. We don't have enough people who are adept at dealing with the old age problems. We
hmm,
have people who are doing fantastic work.
hmm,
Uh, Certain NGOs which are doing lovely work with Alzheimer's and things like that. But
hmm,
it's a flash in the pan. It's just a small little needle in the ocean.
hmm.
We need much more that is available. And sometimes it's really, really sad. I mean, you have a person who's an MBA in finance and you say, Uncle, how much is 1 plus 1? And they say, I don't remember, beta. It breaks your heart. Dementia is horrible, and most of us are going to get it as we grow older. You
Hmm.
like neurodegenerative issues. We're seeing so much of Parkinson's, so much of other problems that we see. Old age is not the best thing in the world.
Hmm, hmm, hmm. But sir, my question was about the caregivers.
Yeah, sorry. So the
Huh.
caregivers do get affected. Of course, they would.
Hmm.
If you know that it's a small period of time. So, for example, if you know that I have a heart attack and after 6 weeks I'll be fine, the
Ah,
caregiver would be happy.
yeah.
But here you have a situation where you know he's never going to get fine.
Hmm.
Always going to be mentally having a problem. He's always going to physically have a problem. Over a
Hmm.
period of time, you get exhausted. Some,
Yes.
even though you don't want to, you start snapping and snarling. So the caregivers at times face more mental issues than the person affected. The person affected doesn't know he has a problem.
Yeah.
The caregiver knows that he's behaving badly. So you have a lot of people feeling very guilty about getting angry with
Hmm.
the person they're looking after and who they actually care for. But I mean, you're a human being, so
Yeah.
sometimes you lose your temper.
Yeah. So they come to you for help, and you. Okay.
And I
I,
tell them, not bad people. We all have temper. We are not God. We are
yeah.
not angels.
Hmm.
Sometimes snap and snarl. They need to take breaks.
Oh,
Sometimes
yes. They need to take breaks, right, sir?
breaks there's nobody else, but they absolutely need to take breaks themselves.
And sir, can you advise us something in general, like while we are interacting with long-term caregivers, how we can be not insensitive towards them, or by hurting their sentiments, maybe unknowingly making some comments, like
Yeah.
if you can explain little.
I think it's not only for
Right.
caregivers, I think it's for everybody. Do not presume that you know what is happening to that person because you're never in that person's position. So sometimes you say, Arey, look at the way he's talking. You don't know what he's been through. Look at the way he's dealing with that person. You don't know what he's been through.
Yeah.
So don't presume that from your exalted position, you know what is happening and that you can give advice and you can pass comments. Because the Lord forbid, if you were in a similar position, maybe you do
Yeah.
worse.
And sometimes they say, "Na, you are the God chose you.
Ah,
God has." Yeah, that is.
like beating up that person.
Yeah.
And the other thing, of course, is that if somebody, for whatever reason, expires early, then you say, God calls the people he loves first. That is
Yeah. Yes.
so horrendous,
Yes.
should be should be banned. Yes. Yeah.
Yes. Sir, have you ever got frightened looking at your patient?
Never.
No,
Never.
never. Okay. And okay. What is your advice to junior and future psychiatrist in perspective of present day scenario?
Ah. Be very careful about how you go about work.
Hmm.
Be honest and as truthful to the job as you possibly can be. learn as much as you can. Keep being in the psychiatry groups where they discuss cases, etc., because otherwise learning will stop. Uh, Try to live up to being a good doctor, a
Hmm.
kind doctor, and remember that you are privileged because you're in the position that you are.
Okay, that's great. Right. Acha, sir, is the psychiatrist a better partner, a better sibling, a better parent, a better son or daughter? What actually happens in real life?
Well, I'd like to think so, but I don't think so. I think we're just the normal person, just like anybody else. But
Hmm.
yes, maybe be a little calmer in a situation of stress because
Hmm.
we deal with stress all the
Hmm.
time. Maybe we wouldn't be so reactive and so angry because we learn how to not lose our temper when somebody acts like an ass.
Hmm.
Otherwise, we're just like anybody else.
This you were taught during your psychiatry course. This
So
how
you learn. You're not necessarily
learn. Okay.
to learn
Right.
on. Some
Oh,
see your senior doctors behaving in a particular way, which makes sense to you.
okay.
Seems
Yeah.
nice.
Yeah.
So
Okay.
you'll end up doing and behaving in approximately the same way.
Right. Okay. Okay. I said during COVID pandemic, there was a surge in the cases of mental health problems, right? So now post pandemic, is it now decreased substantially?
No, I would
No.
say the same. It might even be more because the people who had toppled over now come for help, and more people have had loss of their own loved ones during the pandemic, or
Yes.
known of somebody who's no longer alive and they get affected, and so on and so forth. You also have a whole bunch of special kids, special needs kids. Now, if they were going to an occupational therapist or a speech therapist or a physiotherapist or a
Hmm.
special ed,
Hmm.
suddenly it was stopped for 3 years and everything was happening online, it's not the same. So there's often a regression that has happened. They lose what they have learned, even though
Yeah.
the therapist has tried their best to do it online, but I mean, it's not the same.
Yeah. Hmm. Hmm.
So
Hmm.
regression, then you have more and more kids coming to us, and then you find that they've regressed, and you have to restart a whole bunch of things, and it's not very good.
Okay. Okay. So one doctor only told me that a doctor should be taught empathy and detachment together in the MBBS course because otherwise you cannot handle two patients with the same professional excellence. With where one patient is a frustrated one, he is saying, "Doctor, what have you done to me? I am worse than before," and another one is thanking you profusely. So, what is your view about this? If
I
you
agree. You have to be empathetic as much as possible.
hmm,
Even though you hit somebody on the head, you can't hit the person on the
hmm,
head.
hmm.
And you have to be detached, otherwise, you go home and you'll crack up. Detachment takes time. Detachment takes time. There are still times, even after so many years, where I cannot detach myself from a particular patient. But fortunately, those are becoming very few. Because if I go home and I am constantly thinking about my patients, and I'll never be able to survive. So
Yeah.
I
Hmm.
as I said, empathy is an absolute must, as is the necessity of being detached.
Detached. Okay. Right. Sir, like there is a tendency of female patients, I also fall in that category, to go to a female gynac because it's very personal and private. Same way, our mental health issues are also very personal and private. So, do you see this kind of any gender preference in psychiatry also? No. Okay. Okay. All right. Sir, what are your hobbies or passion? Like, is that also psychiatry?
No, my hobby is gym. That's what I keep saying. I love the gym.
Yes, yes. Okay.
So I don't do as much gardening as I should, but I like being with plants.
Okay.
I like listening to music, though I don't have so much of time, but I still love music.
What
And
type of music you'd love to listen to?
basically,
Any-
all I don't like the recent dum kind. That doesn't make sense to me. But otherwise, I like music which makes sense. And
Okay.
I love dogs, so that's again a hobby. When I see dogs, I like to play with them.
Mhm. That's great. So, do you dream? Like, what do you dream about? Can we explore with you? No, no dream.
Hardly, hardly ever. Fortunately, no, no.
Right. Okay. I think now I'm coming to my last question. That is, what is your vision of a better India?
My vision of a better India would probably be number one, that there should not be any discrimination based on gender. There should not be any discrimination of any kind based on religion. Sometimes we see that happening, which is not very nice. I would like for there to be more compassion for everybody. I would like for there to be more kindness towards people who have different abilities.
Hmm.
The other day, for example, I went into a coffee house and I saw a ramp
Hmm.
going in. So you could have wheelchairs coming in. And I thought that was lovely. And we need about 100,000 more of those across India.
Hmm.
I'd like to see a cleaner India. I'd like to see a cleaner Bombay. So we need
Yeah.
a horrendously greater number of dustbins than what exists right now.
Hmm.
My vision would be that everybody is as kind to people as they can possibly be, because what I believe that what you give comes back to you.
Exactly. And you should smile. Smiling doesn't cost you anything, no? But some people are they're so miser in smiling also.
Yeah.
Okay. And sir, do you have any message for my viewers, please?
Live the life the best that you can, have as much fun as you can, be as happy as you can. It doesn't take a lot to attempt to find good in people rather than finding bad in people. And when you grow up in life, grow up not by stepping on the shoulders or the heads of people in order to go up, but you grow up by pulling them up with you. I've always believed that.
And if you have any mental issue, take help.
Take help.
You should
Absolutely.
say that.
Absolutely. No,
Okay.
supposed
So, Dr. Chawda, you are like a university of mental health, right? So we have much more to learn from you. So I look forward to have many more podcasts with you in future.
thank,
Thank you so much for coming. God bless you. Take care. Bye bye.
thank you. Thank you so much.
Okay.
Bye
Bye.
bye.